Former President Jimmy Carter making his first public comment since announcing he has cancer. Carter revealing that the cancer, first discovered as a tumor on his liver, has spread to his brain. He says he'll undergo radiation treatment starting today, but the 39th president sounding remarkably calm about the road ahead.
I've had an exciting and adventurous and gratifying existence, so I was surprisingly at ease, much more so than my wife was. But now I feel, that it's in the hands of God.
Joining me now to talk about it, Dr. Len Lichtenfeld, who is Deputy Chief Medical Officer at the American Cancer Society. Dr. Len, good to see you. So 4 spots on his brain. What's his prognosis and course of treatment here?
Well, it's obviously, Greg, it's very difficult to say what any individual's prognosis is. That depends on so many factors. But let's talk about what we now know about President Carter. He had a relatively small single lesion in the liver that's been completely removed, and he has 4 very small spots on the brain that in the past with our older technology we may never have even found. So by removing the liver lesion, by using focused radiation on the brain lesions, the possibility is that he may do very well with the type of treatment that they're offering him.
When doctors perform this, as you describe it, very focused radiation on those 4 different spots, which are 2.5 or 2 millimeters, which is, yes, very tiny. But because they're so tiny, can they actually pinpoint and eradicate them?
Well, the answer is yes, they can pinpoint them and they can eradicate them. But even more important, he's getting a form of therapy, actually a type of treatment, where the research was started when Jimmy Carter was president, just before he was president, and now has produced these drugs that have just been approved by the FDA. This drug he's getting, pembrolizumab. So that pembrolizumab will release the immune system to do what it's supposed to do, that is fight the invader, fight the cancer. And it's very possible it may attack the other lesions that possibly could be in the brain. The key issue here is that in a very difficult situation, and metastatic melanoma that's spread through the body is a difficult situation. This, for President Carter, we're able to get control of what we know is the cancer currently. And finally, he knew about this in May. We're several months later, and apparently no additional lesions have become evident. And that's also a reasonably good sign for the time being.
Right, but they could have been in abeyance. They could emerge at any time. So they not only have to keep a watch on his brain with MRIs and scans of other variety, but the rest of his body as well. These cancers can spread to other vital organs, lungs, so forth.
Certainly they can, and as the president noted, and it was actually a pretty amazing time during his news conference to listen to how he talked about his illness. So he is fully informed. And as the president mentioned, they're going to do serial scans, serial examinations over time. They'll keep looking at him very carefully to see if any other lesions show up. And as he said, the possibility, and if not the probability, is that might happen. But let's remember, he's getting a form of therapy, the immunotherapy, that hopefully will help his body address and sort of use the body's own mechanisms to help treat the cancer.
Well, we certainly admire his determination, his courage, and his willingness to talk so openly and honestly, because I think it helps a great many other people out there who may be facing similar situations. So Dr. Len Lichtenfeld, thank you very much for your insights as well.
Thank you.